fell over, knocked it out maybe 3 months ago. It fell out as I was brushing my teeth.
So go through all your teeth one by one now, okay?
Oh no, perfect. That looks really good. It's the best tooth there.
Come on in. Yes, how are you?
Good, how are you?
I'm good. Can I put this mic on you, is that right?
You can, yeah.
Yeah.
Is there anything I should or shouldn't say?
No, go for it. Why don't
Okay.
just leave it. Basically, I'm making these videos because people find them really interesting.
Yeah.
I still want, the priority is still you and your treatment. So if there's anything that that's private or personal, just tell me and I'll cut it out kind of thing. Right? Yeah.
I saw the
Yeah.
videos, so.
Did you?
Yeah. It's all good.
So people you recognize?
Only 2 or 3.
Cool. Let's talk teeth. So
Teeth. Yes. So
that's fine. Yeah, we'll fix that today. Yeah.
I just did it about 15 years ago.
Yeah.
Under the influence of alcohol, I fell over, knocked it out. It was repaired at the time, and then about maybe 3 months ago, it fell out as I was brushing my teeth. Well, actually, I didn't know where it went. So yeah, you can see they're all sort of slightly misaligned. So the tooth is actually a bit lower.
Yeah.
But I don't. Yeah, you'll probably know how much to build it up by.
Yeah.
But, yeah.
So you said to me that you're gonna consider Invisalign at some point.
I think so.
Anyway.
Yeah, my top teeth are fine, I think. But I had braces a long time ago, and I stopped using the retainer on the bottom. I don't know why.
Yeah.
I've always used the top one still.
Oh, just didn't do the bottom.
Yeah,
Okay, fine.
Just didn't do the bottom one. You can see they're sort of like.
Yeah, they're crowding up again.
They're crowding and there's so it makes that tooth stand up quite a lot.
Yeah.
This one's coming forward, so. But yeah, I didn't know how that would affect what you do today. Would that affect realigning in the future?
So
it's not real tooth, if you know what I mean.
No, it won't affect that.
Okay.
Yeah, Invisalign and everything will still work.
Yeah.
Normally, I would say let's do the Invisalign first to get them all aligned and level because. Like you said, when your teeth are crowded, the pressure points are all different, and if you've got one sticking out and you've got to build up, when you're chewing and stuff, you're going to put more pressure on it.
Sometimes like that tooth gets really sore and I bite like a really hard, like cookie or something like that.
Exactly. So the idea is we align them all so everything's nice and balanced, and then we build it up so it's like level with everything.
Okay.
But obviously, wedding's end of February, isn't it?
Yes. Yeah.
So what we'll do today, I'll smoothen that off and just rebuild it.
Okay.
Kind of, probably not the same level as the one next to it.
It will look weird.
Exactly, yeah. So I'll just make like a judgment call on just to make it look smooth.
Same size toothish.
Yeah, exactly. Yeah. So it's not like jagged or anything.
Okay,
and then in the future, when you do Invisalign, you level them all out and then the edges might be a little bit off, and then we just sort of adjust the teeth to make them all look smooth again.
Okay.
So
is that all the teeth or just the build up?
It'll depend on, because when your teeth are crowded, when you're chewing and stuff, especially your bottom teeth, they wear down, and if they're crowded, all the teeth wear down at different rates.
Right. Okay.
So when we align them, they're always inadvertently a little bit off. So then a lot of times after Invisalign, we need to do just a little bit of recontouring to make them even.
That sounds about right.
Yeah.
How soon I get around to doing Invisalign, you never know. But
exactly.
It's always been on my to-do list for a long time. This seems like a good place.
Good little trigger point,
A long time.
What about the rest of your teeth? All good?
I think so. I think I've potentially got. I haven't been to the dentist for a few years.
Yeah.
I don't know whether a few is like 3 or 5 or I can't really picture because I only went at home where I grew up. But I think just from looking, I don't know if I've got a couple of holes in one of these.
Okay, fine.
You'll probably be able to see.
Holes that you can see, or do they give you any pain or anything?
I don't really get pain. Sometimes it's sensitivity.
Fine. Right.
But I can see them.
Fine. Okay.
In the mirror, so they're probably massive craters.
Bottom left, do you think?
Yeah.
Fine.
No,
okay. Cool.
But other than that, I think fine.
Cool.
Had all 4 molars removed a few years ago, which is quite nice.
Good.
On that. All good.
Perfect.
Well,
so what we'll do?
Yeah.
So I'll do a full checkup, take X-rays of your teeth, take a scan, have a look at everything. If there's anything major, I'll let you know, and we can maybe prioritize that or something.
Sure.
But and then after the checkup, I'll build up this bottom tooth.
Nice. Okay.
Cool.
Sounds good.
Yeah.
Yeah. Do what you need to do.
Cool.
Login into yours in case Evelina will text us.
Okay. Yeah. Straight to work from here?
Yeah. It's not too bad from here. I'm over in that's up Regent Street way.
Okay, fine.
Just across the city.
Did you have to get evacuated yesterday?
Do you know what? I wasn't in the office yesterday. I was outside. It was right by my office.
Oh, was it?
Yeah.
This car?
The car, yeah. Just pop these on.
Should I take these off?
Yeah, go on.
What was it in the end? It wasn't no threat. No?
I don't know. I'm going to find out probably today.
I read last night that it was nothing.
I think.
Yeah.
I saw a video of a one of those bomb disposal.
Yeah. I think they blew up the car, but it wasn't anything. So people are saying that it is someone who's just parked the car and gone shopping.
My friend sent, I think it's the same car as mine. It's like a Golf, and I think my friend sent me a video. It was like a bad day to drive into work. But yeah, so.
Oh, crazy.
Exciting.
Go on, tilt your head back. I'm just going to feel on your jaw first, okay? Okay, and open as wide as you can, and close together. Cool. And clench together for me, and relax. And clench together there, and relax. All right. So this is all part of our cancer screening that we do for everyone. Okay. So open really wide. So relax your cheeks for me. Perfect. So just checking your cheeks, your tongue, your soft tissues. Cool. And stick your tongue out and into your right cheek, into your left cheek, and curl it up for me. And relax there. Cool, that's all looking healthy.
Good. Start.
You don't smoke, do you?
No.
Open it really wide. So go through all your teeth one by one now, okay? So Victoria, we've got upper right 8 missing. 7, 6, 5, 4, 3, 2, 1. Upper left 1, 2, 3, 4, 5, 6, 7, and 8's missing. Cool. Lower left 8's missing. 7, 6. Just put a watch on the occlusal of the 7 and the 6. 5, 4, 3, 2, 1. Lower right 1 is fractured. 2, 3, 4, 5, 6, 7, and 8's missing.
What does that do?
The air,
is that just
to dry it out, yeah. Just because obviously your teeth are covered with saliva, the air just dries it all out so I can see properly. Cool, so open really wide. So I'm gonna check your gums now, okay? So just close halfway for me. So basically we're screening for gum disease. And this is like a little probe. And I'm just checking how tightly attached your gums are to your teeth. And just to see if they're bleeding or not. So do that, just a few points around all your teeth. So Victoria, upper right's 2. 2 means that there's just a little bit of calculus, which is quite normal. So upper central's 2. And upper left's 2. Lower left's 2. So open really wide. Lower central's 2. And lower right's 2. Cool, so there's not a lot of gum bleeding, which is good. A little bit of calculus building up, which will happen if you haven't been for a few years.
Yeah.
So I'd suggest seeing the hygienist at some point.
Yeah.
For like a cleaning.
It's also on the list.
Yeah. But in general, things are looking quite good. Okay. So, I'm going to take some x-rays of your back teeth now, okay?
Yeah.
Clinically, I can't see much wrong, to be honest. On those bottom left, you've got little bits, kind of like early cavities, like a little bit of pitting and some staining.
What those, the blacks?
Yeah.
Right, okay.
So it looks a lot worse than it is. I'm going to take x-rays and see how deep those are.
Okay.
A lot of the times, there's a little bit of decay on the surface.
Yeah.
That's just arrested.
Okay.
Because you've had that molar you've had since you were 6.
Right, yeah.
So if it's got a little bit of decay, but then you start cleaning it and its decay is like arrested, it leaves a little bit of staining.
Okay.
And then hopefully that's it.
Yeah, okay. Fingers crossed.
But
I think there's a filling somewhere in there as well.
Yeah.
I can't remember when or where. They've only got one, but...
Yeah, I didn't obviously see one, but I'll see on these x-rays as well.
Quite well.
So open really wide for me. Cool, just close together for me there. Brilliant. So stay nice and still. I'm going to pop out for just a second. Okay, and open really wide. Open really wide again. Cool, and yep, just bite down all the way. Cool, and open really wide. Cool, so what I'm going to do now is take a scan of your teeth.
Cool. How long have you been out in Canary Wharf?
Here, about 2.5 years now.
Nice.
Yeah.
So
I do 2 days a week clinically here.
Yeah.
And then I'm the director of the place, so then I do a lot like the running of the stuff. Like when I'm away traveling and stuff, I'll still be like...
Doing admin stuff.
Yeah, doing all the admin stuff, looking after everyone.
Nice. It's a good spot.
It is nice, yeah. It's just a little bit out of like the busy walking areas, which is hard for us to then get busy.
Yeah, that's true. Footfall.
Yeah, exactly. So open really wide.
Relaxing with these glasses on, I feel like I'll fall asleep something on the beach.
For some reason my scanner is not... The scanner wasn't connected properly, so I just had to restart it.
Oh, okay. Technical glitch.
Technical issues.
Yeah.
Cool. So, open really wide.
Was that making like a scan of the tooth?
Yeah, so it's a scan creates like a 3D model.
Oh, cool.
And then we can use that to like 3D print your models of your teeth to make like retainers, wiping trays, Invisalign, all that kind of stuff. So you don't need to have like molds taken.
Yeah.
and it allows me to keep like a really good record. So if you ever call me later and be like, oh, I've got this issue, I can see exactly how your teeth were, rather than just like my written notes.
I swear.
Sorry?
Sorry, when you're lying with your mouth open, you feel like...
Yeah. You start, when you're the dentist, you also start thinking about everything loads.
Yeah.
Open up, bite down together for me. Okay, open up really wide and bite down together for me there. Yeah, it's really straight. Like some patients will be like, they'll constantly want to like get up and spit out. They're like, oh, there's so much building up. And I'm like, there's nothing different to like just your day to day.
I know. I think it's your mouth open and swallowing with your mouth open is like impossible.
All right, cool. So give me a couple of minutes just to have a look at these.
Yeah, sure.
X-rays.
Do I still have these specs on?
You can take them off for now, yeah.
Okay.
Let's come up with 2 different ones. Oh no. Never mind, it's all good. Okay. Brilliant, right, you can swing around and have a look at all of these. So,
There we go.
cool, I'll just take those. So this is the scan that we've just taken here. Yeah, that blue bit is just like a part of the model where the scans.
And the bottom. It's like, is it
right, yeah. That's the kind of sort of natural sort of translucency
as they
that
get,
teeth have. Yeah.
You can also see I chipped, when I knocked this one out,
Yeah.
it went, so I bit the bottom 2 into those 2 and it, you can see
kind of chip there, yeah.
all the way across to there.
Yeah, having an element of like chipping is kind of natural for people. And you can also see, it more evidently in your bottom teeth as well. Like it's like it happens from either singular trauma or if you bite your nails, if you grind your teeth, if you clench, if you chew pens and all that kind of stuff as well.
That stuff, but I think I guess it all happens.
Yeah. So then the bottom teeth, so like I said, they're crowded a little bit.
Yeah.
In fact, Invisalign to straighten them up will be very straightforward. They're very sort of minimally crowded. You're looking at like
these ones.
Yeah. We'd kind of bring those teeth out a little bit, just to create some room. Just do a little bit of stripping to create some space and kind of push all those teeth like in again.
Yeah.
And then when we do that,
you can see how much lower that one is to that one.
Yeah, because if you look at the gum line, like that one's lower and it's kind of pushed forward like a little bit. So we'd level those up and then just fix the edges. Like there's a little chip there. They're a bit like jagged. So then we would just
like
sort of
range,
So we just smoothen them across, basically. But in terms of the holes, so in the bottom left, that's probably what you're seeing.
Yeah.
So that area there and that area there.
Yeah.
On the X-rays, they're not looking like deep decay.
Okay.
So they're kind of more just small surface lesions.
Okay.
So we just need to keep an eye on those and keep them really clean.
Yeah, fine.
When you see the hygienist, she'll use some airflow. That will help some of the staining, but it's not going to get rid of it completely. If you ever did teeth whitening, that would make it look a little bit better.
Okay.
But there's no need for me to then cut a hole and then replace them.
Yeah.
Because these are the X-rays that we've taken of those teeth.
Put these on. Yeah.
So these are the X-rays, and what we're looking at, that's the enamel layer of your tooth.
Okay.
That's the dentine, and we're looking to see if there's any cavities there, and those molars are looking completely fine.
Oh, that's
so
good.
if it's decay, but it's just kind of like in that surface
Fine.
area.
Okay.
And the enamel of your tooth is really tough and resilient. It's only when decay gets into this softer dentine layer, that's when you get pain, that's when it gets worse, and that's when we need to do a filling.
Fine, okay.
So just keep those really clean, and then we'll keep an eye on it. And then we take these x-rays to make sure there's no decay like in between the teeth. And it's all looking fine.
Okay.
Yeah, no problems or anything.
News. Okay. Dentistry's moved on a bit.
It's good,
Yeah.
These scanners are really good.
Yeah.
Like, they help. And there's a
imagery
little filling in that tooth, which is completely fine.
Yeah. Is that the filling?
Yeah. Yeah, it's just loads of images. So
wow.
when I was doing it, you're hearing all like the beeps.
Yeah.
They were all pictures, and it's kind of stitching it all together.
Nice.
Then it like renders it, and then we can 3D print those, and we can do all sorts with them. It's like, obviously this is on record now, so like I said, if you ever call me in the future, be like, oh, something's wrong with my teeth, I can open this up and be like...
Well, actually, you mentioned retainers, and it reminded me of all the other things I haven't done, and the retainer that I wear is probably, I don't want to think how old it is.
You don't have it with you, do you?
I had it replaced once, but I had my braces done when I was maybe like 17 or something.
Yeah.
So
it's probably worth
something in between. Yeah, I know. It's on the list. But yeah. So.
Cool. Right, sit back and we'll build this bottom teeth up for you.
Sorry, I'll put that on there.
No worries. So, building this up will be really straightforward. I don't need to numb the tooth up or anything.
Okay.
I'm just going to smoothen the edge off
and
then build it up and polish it. Okay. So it should be quite quick and quite easy for me to do. Are you going to consider whitening your teeth at all?
Yeah, probably. I mean, I think I've started getting a bit less white, so I've always never been quite sure about what whitening the teeth does. To the enamel and stuff like that.
It's totally safe.
Yeah. Oh, yeah. I put the glasses somewhere, but
I'll get them for you. Okay. Yeah, don't worry. Just open up for me. We'll do A1.
The Venus one?
Thanks.
Yeah. Because the one thing you need to consider is when we build the tooth up, if you ever whiten them, the filling's not going to change color. The build-up isn't going to change color. So if you whiten them and it looks off, then you'd have to just replace it. But I mean, we can factor that in.
Okay. Yeah. Because I guess so it needs to be the same color now. But
yeah. Or I can make it like slightly brighter now to the point where it's not going to be like so obvious.
If I was going to whiten my teeth, I don't think I'd do it too much.
Yeah. And you got time to do it before the wedding as well.
Yeah. Okay. Yeah. I don't really know.
Yeah.
I've never looked into it, but a couple of shades maybe.
Yeah. Cool. So, to be fair, I'll just A1 will be perfect, and then if you whitened it, it won't look too off anyway. Cool. Bite down together for me. Cool. And open it really wide. Okay.
So quite a quick process to whiten.
No, not at all actually. So the best way to do it is like with home whitening kit. And we make you some whitening trays from the scans we've taken. And then you wear those trays overnight for about 2 weeks with like a whitening gel in them.
Okay.
And it kind of gradually whitens your teeth basically. And whenever you're happy with the color, you can just stop.
Okay.
So it's not like Ross from Friends kind of situation where you're gonna walk out and have
like
suddenly fake looking teeth.
Ultraviolet blue.
It's always very natural. You're more at a risk of like thinking it's not white enough than you are like overdoing it because you're kind of in total control.
Yeah.
Cool. So I'm gonna put a little retractor in just to get your lips and cheeks out of the way. It can be a bit fiddly. There's no gracious way of doing it.
Okay.
So open really wide. Okay, just relax your lips there a bit so I can tuck that in. Okay, fantastic. So if at any point it's sensitive or anything, just let me know, okay? Cool, so open really wide. Cool, so open really wide, just gonna smoothen off this tooth first. Okay. So just give me the edge, please, Victoria. In fact, sorry, just give me a clear strip first as well.
You have it in front.
Just get me another clear strip.
You had to. You don't have it. You've lost.
Oh, it's here. It's here.
Yeah?
Yeah.
Do you want a metal strip?
Nah, it should be fine. Yeah, we're good. Cool. Fantastic. So it's easy to keep that tooth really dry, okay? So basically we're smoothing that tooth off. We use a little etch just to prepare the surface. And then this is the bond that's going to help the build-up stick to the tooth. Open really wide for me. Great. Composite. Okay, secure that. Okay, secure that for me.
What are you looking for?
The metal strip. Where's that go?
Behind the row. Under. Oh.
Oh yeah, got it. Okay, secure that for me. Cool, so build that tooth up, that's just setting there, and then I'm just gonna trim it and polish it down, okay?
All right.
You all right there?
Mm-hmm.
Just open wide. Try and keep your tongue tight. Cool, so open really wide for me there. Cool, just bite down together for me. Okay, and slide your lower jaw forward, sort of grinding against your teeth there. All the way, keep going, keep going. Okay, and open really wide. Cool. Nearly done, Tom.
All right.
Bring your tongue back. Yep, perfect. Open up really wide. Tongue back again. Yeah.
From my side.
Give me etch and bond. Just gonna put another layer on that. Secure that. Yeah, that's enough for today. So open really wide. Right. Fantastic. Right, let's set you up. How's that feel for you?
Yeah, the tongue's just getting, yeah, it's been a bit dry there. Yeah, it feels good.
Feel smooth and stuff, yeah?
Yeah. Nice.
Cool. I can show you what it looks like as well.
Oh no, perfect. That looks really good. It's the best tooth there, man.
Yeah, obviously you have to try and like build it up and not make it look too perfect. You got to make it like blend in.
Yeah. That looks great.
To the other ones. Let's have a look.
That's really good.
Oh yeah, perfect.
And hopefully when it all gets realigned.
Yeah.
Great.
Cool. So, what I'm gonna do you think you will get your teeth whitened or not?
It depends, I guess, if I could do a bit before over the next couple of weeks. Then
Yeah.
Is it something you have to do over, like a month? Or?
So usually you do it for about 2 weeks. So we order your trays. They take about a week to get made.
Okay.
Then I'd suggest I'd send the scan off, book in with a hygienist for like a cleaning, and then she would fit your trays, and then you would do it overnight for a couple of weeks.
Okay.
So that'd be the best way to do it.
It's the sort of thing I might do because I'm going away in a week, just over a week, for a long weekend. So I might as well do it when I get back. Maybe.
Yeah.
I'd say.
Cool. If that's the case, I'm gonna take a new scan of your teeth because that old.
Well, I might as well just.
Yeah. Just get the scan tip.
Yeah.
Cool. Because obviously if we use the old scan, and it won't fit because the tooth has changed.
Yeah.
Right.
So I took the specs off one more.
That's all right. Don't worry.
Okay. I remember I sort of took a while to get used to when it was broken.
Yeah.
Having no tooth.
And now it feels odd again. Now that you got a tooth there.
Does it set almost instantly then?
Yeah, it sets straight away, so you're good to go. With I would say you can eat on it and everything, but obviously you still need to be careful. Yeah.
I remember for so long.
Was that sorry?
Is there anything else that you think I should be sort of doing with my teeth?
Um,
Now I've been to the dentist for a while.
No, actually.
With my sort of brushing of the teeth and stuff, but...
Your cleaning's quite good.
Okay.
When you see Geeta, the hygienist, she'll go over that in like more detail with you.
Okay.
Fine.
Fine.
Hold on one second, let me just push on through.